From testing to treatment to awareness, medical experts are making sure no one fights cancer by themselves. So joining me now is Dr. Mahdi Taha, a medical oncologist at Delray Medical Center and Palm Beach Health Network. Thanks so much for being here.
Thanks for having me.
Let's just talk in general about cancer treatments because they are constantly evolving. Where are they standing? What are the most exciting breakthroughs that you're seeing right now in the world of fighting cancer?
We've made tremendous strides in fighting cancer. There's targeted therapies, immunotherapies, exciting new therapies like CAR T therapy that we can offer our patients for cancer treatment. We're able to actually personalize and individualize treatments by looking at patients' actual genomic mutational analysis for their cancer.
Let me ask you, because I hear a lot about this, the research. I know it's ongoing, but is the research been stepped up? Is there more success coming these days?
Absolutely. There are numerous exciting new therapies that are personalized for patient care, that are streamlines that provide individualized treatment for our patients based on this research.
Right now, this word that we hear, immunotherapy, is so significant and can make such a difference. Can you first, before we even delve into it, explain what it is?
Yeah, the way that I explain it to my patients is it's your own personal T cells, which is like your personal army that reinforces your immune system to attack cancer.
And how do you go about deciding what immunotherapy works for each patient? And obviously it must be geared towards whatever that form of cancer is that they have.
After conducting significant testing for our patients, what we do is individualize and personalize the treatment for the patients. Some immunotherapies are involved with numerous cancer types. As of today, some immunotherapies have 39 indications for cancer as we speak right now.
So that would be significant because that can cover a wide range of the disease?
That's correct.
All right, and how do you go about obtaining these? I'm assuming they may be very expensive. Are there clinical trials going on? How does this work?
Well, not only are there clinical trials, but this is standard of care. This has been approved by the FDA. It is supported by the National Comprehensive Cancer Network, and usually it's covered by most insurance companies.
And is there anything new on the horizon that you're looking at and hoping, as soon as I can get that, I need it?
Especially looking at genomic testing with patients. We're able to look at the patient's DNA and RNA and make decisions based on their personal mutations. We are actually looking at the patient's personal serial number and identifying mutations that are present and prescribing therapies that are tailored to that mutation.
Everybody wants a cure or therapy right away. How long does this take and how effective can it be?
This is true. And early detection is the most important factor to that question that you posed. Early detection is the most important factor in identifying the cancer and offering a robust and effective treatment option.
Now, as far as early detection, I'm assuming that is constantly advancing. What are the latest advances in detecting? Because we all would like to know, but there are scans, there are tests, there are screenings. What do we need to know?
What I tell my patients is make sure you attend and go to your wellness visits with your primary care. There are annual screening tests that are conducted for lung cancers, colon cancers, breast cancers, and those are important because we just mentioned how important early detection is, and that's your best step at providing early detection for cancer therapy.
All right, now, someone hearing this, our discussion today may say, well, I want to know, is that me? Should I be getting all of that? How do you decide which screenings, which testing you should get for early detection?
The first step is speak with your primary care. They are well-versed in regards to screening tests that are responsible and effective for detecting these cancers.
Are there certain criteria that patients want to know about that they're probably very scared when they first hear a diagnosis? What are the criteria you use to put them at ease and to develop a plan?
The first thing I tell them is that they are not alone. We're going to walk through this journey together. We make sure that from a social perspective, because that's what they need at that time, they need an effective treatment plan, but they also need social support, meaning their family, friends, loved ones, in order to provide effective treatment for them, for the patient. not only from a systemic therapy option or surgical treatment option, but also emotional support. And I let them know, we're going to walk through this every step of the way.
All right, I'm sure that really helps them in many ways, including just their psychological well-being as they approach this. What are patient survival rates now compared to the way they were, especially with early detection? And I know we're covering a wide range of cancers,
Sure.
but where do we stand?
They continue to improve, and it really depends on the cancer type. That is why screening modalities are so important, because the earlier you detect the cancer, the better the outcome. And we continue to improve on that between clinical trials, utilizing DNA, RNA, and even artificial intelligence to find information out that better understand what our patients are going through and what they're experiencing.
All right, I know we're talking very generally about cancer, but for people with family history of cancers, who needs to be proactive? I mean, we all do,
Yeah.
but who really needs to be zoned in on this?
Well, I'm going to tell you, I think everyone needs to. And the reason why is this. Your personal family history is your roadmap. And I know in social gatherings so many times, we don't really talk about that, but I think it's so important because it tells you so much information about your family when just by asking the simple questions from your loved ones. So family history is key because it provides you an opportunity to understand what is going on from your health, because we all have similar DNA within our family, and it makes a difference as to what we can be exposed to and what we can have from a cancerous perspective in the future.
All right, Dr. Taha, thanks you so much for going on the record with us.
I appreciate your time.
We appreciate your time. Thanks for
you.
joining us.
Thank you.
Coming up, we'll talk about the latest advancements in the fight against breast cancer.